lecture today is soft tissue rheumatism or rheumatic regional rheumatic pain syndromes or local rheumatic disorders. The three are the same. This includes problems in the muscle and muscle insertion problems, tendon and tendon sheath problems, joint capsule disorders, para-articular ligamentous disorder, dorsal inflammation, pressure neuropathies or interruptant neuropathies like carpal tunnel syndrome and radial nerve palsy. Actually, these conditions are very common. Soft tissue rheumatism plus back pain equal 50% of consultation in general practice of medicine as a whole, not rheumatology only. This includes 62 well-defined conditions. The principles of treatment of these conditions are the following. 1. Rest. 2. Drugs. Non-steroidal, local steroid injection, non-steroidal orally or topical ointments. Physiotherapy and supplements and supports. Rarely surgery is indicated. Very unlikely surgery is needed. So as just we have said, it includes 62 well-defined conditions. As just we have said, it includes 62 well-defined conditions in the shoulder region, in the elbow, in the wrist, in the hips, in the knees, and in the ankles and feet. So we shall start the conditions around the shoulder joint, para-articular rheumatic disorders around the shoulder joints. The first one is impingement syndrome or rotator cuff syndrome or rotator cuff tendinitis. The commonest one of this syndrome is supraspinatus tendinitis or supraspinatus syndrome, SSS, is predominantly involved, but the infraspinatus and subscapularis tendons can also be the source of tendinitis. Supraspinatus syndrome or supraspinatus tendinitis is a very common cause of shoulder pain, and secondary subacromial bursitis may be present. Clinically, the patient having shoulder pain. There is a mid-painful arc syndrome, so the pain at the middle range of abduction between 60 and 100 degrees, so-called painful arc syndrome. Painful arc syndrome. Yes, this is the painful arc syndrome. Later it might become chronic and calcification deposits in supraspinatus tendon or subacromial bursae. Calcification is calcium hydroxyapatite crystals. It is believed to be due to repetitive trauma. Treatments are as the general rules: rest, non-steroidals, physical therapy, and sometimes one may need local steroid injection. The other condition in the shoulder region is adhesive capsulitis. Adhesive capsulitis. Adhesive capsulitis, also it is called frozen shoulder, associated with shoulder pain and tenderness and severe loss of active and passive movements of the shoulder movements in all plants. Usually it occurs after 40 years of age. The patient is more than 40 years of age. It might be secondary to any type of shoulder problem. Usually it is associated with diabetes mellitus, DM, after CVA, cerebrovascular accident, IHD, ischemic heart disease, and after immobility. The capsule looks thickened and contracted, the shoulder capsule. Adhesion adheres to anatomical neck and axillary folds. The volume size of the shoulder capsule reduces very much, from over 30 ml to only a few mils. After clinical diagnosis, one should exclude any hidden pathology. The two important features of this syndrome is severe restriction of movements in all the plants, in all the movements, and pain. The pain is usually increased at night. Treatment of frozen shoulder or adhesive capsulitis are by non-steroidals, by local steroid injection into the glenohumeral joint or subacromial bursa, or by occipital tendon sheath. Physical therapy. The third line is the physical therapy. Physical therapy is of extra amount of importance. Shortwave, microwave, ultrasound. You may use some of these instruments, physical instruments, to be followed by gentle range of exercise, pendulum exercise, and wall climbing with the fingers. Finally, active and increasing exercise and resistant exercise. Some cases and some severe conditions, manipulation under GA. So MUA in resistant cases may be needed, to be followed also by physiotherapy course. Now, in the elbow region, in the elbow, we have in the elbow region, we have the lateral epicondylitis. Lateral epicondylitis has a popular name, which is tennis elbow. So there is localized tenderness over or slightly anterior to the lateral epicondyle, is the hallmark of this disorders. Normally, lateral epicondylitis remits in several months. It consists of degeneration of the common extensor tendons, particularly extensor carpi radialis brevis. A treatment is by rest, by altering gravity activities, forearm brace, non-steroidals, local steroid injection, isometric exercise, heat therapy, shortwave, or ultrasound physiotherapy. It is called tennis elbow. In our community, we call it Kenneth elbow, related to the housewife Kenneth. Housewife's tennis. The other condition around the elbow is the Golvar's elbow. The Golvar's elbow is the reverse of the lateral epicondylitis. It is medial epicondylitis. Actually, medial epicondylitis is less common than the lateral epicondylitis. The other condition is the olecranon bursitis. Olecranon bursitis in the region of the elbow. Here we have inflammation of the olecranon bursa. It is a non-infectious inflammation of the olecranon bursa. So it is non-inflammatory olecranon bursitis. Might be due to repetitive friction trauma. Here it is called student elbow. Student elbow due to repetitive trauma. Other causes also olecranon bursitis might be seen in other conditions like rheumatoid arthritis, gout, and calcium pyrophosphate crystals disease deposition. Sometimes the olecranon bursa is infected. Here it becomes a septic olecranon bursitis. In such a condition, this condition needs a drainage and antibiotics. Now, in the wrist region, we have dequarvans tenosynovitis of the abductor pollicis longus and extensors pollicis brevis. Another condition, tenosynovitis of the flexor tendons. Another common condition in the wrist joint is the carpal tunnel syndrome. Carpal tunnel syndrome is an interruption in neuropathy of the median nerve and when it passes in the carpal tunnel and the wrist. Here the clinical presentation is with paresthesia and the lateral 2 or 3 fingers and thumb, while little finger is spared, not affected. There is paresthesia mostly at middle of night. Paresthesia may spread up to the arm. On examination, there is sensory some sensory loss, and the pinprick will show changes in the median nerve distribution. Tunnel sign also might be positive. And Fallen's sign, Fallen's test. By Fallen's test, the wrist is flexed for 1 minute. Symptoms will reappear. The causes of carpal tunnel syndrome, CTS, it occurs in 50% of rheumatoid patients. Also, it occurs in cases of fluid retention with like in the pregnancy. So in the pregnant ladies, the carpal tunnel syndrome is transient and will resolve spontaneously after delivery. Also, it is seen in the pre-menstrual tension area time in females. Also, carpal tunnel syndrome might be seen in myxedema, in gout, or due to old injuries, or it might be idiopathic. A treatment is by rest of the wrist. Advise the patient to rest his or her wrist. And by symptomatic treatment, sometimes one may need surgical release of the transverse carpal ligament in severe cases. The other condition is radial nerve palsy. Radial nerve palsy, also called a Christmas night syndrome, ليلة عيد الميلاد, or Saturday night syndrome, or crutch palsy, axillary crutch palsy. It is due to compression of the radial nerve in the axilla, presented clinically as wrist drop or partial wrist drop, or weakness of the extension of the wrist. after a drunky night, after a drunky night, يعني ليلة عيد الميلاد كذا, they drinks and they fall asleep, so they sleep on their axilla, so there will be pressure on the radial nerve in the axilla. Also, it might be due to uses of axillary crutches, العكازة الأوطية. It is a neuropraxia of the radial nerve. Neuropraxia is a transient physiological block. It carries a good prognosis. This differs from partial or complete cut of the radial nerve. When we have partial or complete injury of the radial nerve, it is called neurontemesis or axontemesis, in which the prognosis is not good. But in our condition, in radial nerve palsy, in a Christmas night or crutch palsy, the prognosis is very good because it is due to a transient physiological block. It is called neuropraxia. Usually there will be return of the radial nerve function after days or a few weeks. Treatment is by race, is by physical therapy, by electrical stimulation, and by exercise. No. In the hip region, we have the trochanteric bursitis. Trochanteric bursitis frequently pass undiagnosed. Pain in the trochanteric area and lateral thigh. The best way of diagnosis is by palpation of that trochanteric area. You will elicit pain and tenderness. Other condition is called ischial bursitis. Ischial bursitis in the ischial region. Also it is called Weaver's bottom. Weaver's bottom, يعني البottom of the weavers, الحائك, due to prolonged time of sitting. Here, the best treatment is by using a soft cushion for sitting on. Another condition is myalgia parasympathetica. Here we have palsy of the lateral cutaneous nerve of the thigh, which is L2, L3 roots. It is a sensory nerve. Entrapment in neuropathy of this nerve, lateral cutaneous nerve of the thigh, giving a distribution of the lateral area of the thigh. This distribution is called lorry driver pocket money distribution. So the lorry driver pocket money distribution. Yes. Causes are diabetes, pregnancy, obesity, trauma, or compression from a corset. Treatment, the same general principles: reduction of weight, correction of heel, الكعب العالي. Sometimes one may use local injection. Another condition is adductor tendinitis. The adductors of the thigh, tendinitis in the adductors of the thigh. It is elicited clinically by asking the patient to do adduction, resist, and you resist it, so the pain reappear. Now, in the knee region, we have a condition called patellofemoral patellofemoral pain syndrome. Patellofemoral pain syndrome, also called chondromalacia patelli. This is a spectrum of knee disorders resulting from excessive pressure on the patellar cartilage and the subsequent softening and fibrillation of its articular surface. Most patients are female in late teen age. Patients complain of anterior knee pain, which is felt in climbing or descending stairs, صعود ونزول الدرج, sitting for long periods, or squatting قرفصاء قمص, or after long walking or traveling. Long walking يعني هذول المشاية. On examination, pain occurs when the patella is compressed against the femoral condyles and when it is displaced laterally. This test is called patellar stress test. So patellar stress test is positive in patellofemoral pain syndromes, which is called chondromalacia patelli. But keep in your mind that this test, patellar stress test, is also positive in patellofemoral OA, osteoarthritis of the patellofemoral articulation. X-ray is usually negative in chondromalacia patelli, but lateral X-ray may reveal a high riding patella. That is, this view is called a skyline view. A treatment of patellofemoral syndrome. Actually, patellofemoral syndrome is very common. It's very common. The lines of treatment are the following. 1. Avoidance of activities that increase the pain. شنو هي الactivities? Cycling, bicycle, getting upstairs and downstairs, صعود ونزول الدرج, squatting position, long walking, المشي الطويل. So you should avoid such activities. The second line of treatment is the quadriceps isometric exercise to strengthen the quadriceps muscle by static movement, static, not static, stable movement, we mean. So the quadriceps will strengthen, but there is no movement of the joint. Building the quadriceps will stabilize the knee. The other line of treatment is non-steroidals, the physical modalities. Okay. In the knee in the knee region, we may have popliteal cyst. Popliteal cyst, also it is called Baker's cyst. Baker's cyst. A person called Baker who described this condition, so it is called Baker's cyst. The translators to Arabic ترجموها كيس الخباز. طبعا this is very wrong translation. Here we have pain in the popliteal fossa and swelling in the popliteal fossa. Usually it is reducible in mid-flexion of the knee. Any knee disease with synovial effusion can lead to popliteal cyst. So it occurs in rheumatoid arthritis and osteoarthritis. Another condition in the around the knee region, we have what we call prepatellar bursitis. Bursitis of the prepatellar bursa. Here we have an inflammatory bursitis of that bursa. Also it is called housemate's knee, رجل الخدامة. The pain and tenderness and swelling in the lower half of the patella, and that prepatellar bursa. It is an inflammatory, but sometimes it might become infected. Here it becomes aseptic bursitis. We have another bursa, is the infrapatellar bursitis. Infrapatellar bursitis is called the clergyman's knee, رجل القس, due to many times praying, due to friction of the infrapatellar bursa. Now, disorders of the ankle and foot region. Ankle and foot region, we have the Achilles tendinitis. Here we have a tendinitis and the Achilles tendon sheath. Treatment by rest non-steroidals, by shoe correction, splint or physiotherapy. In Achilles tendinitis, local steroid injection is contraindicated. It should not be used because it might lead to weakness of the Achilles tendon and might lead to rupture of the Achilles tendon. So you should avoid local steroid injection into the Achilles tendon. Beware. Another condition is called pes planus. Pes planus is a flat feet. Here we have loss of the longitudinal arch of the foot on medial side. Another condition is calcaneal bursitis and plantar fasciitis. Here we have pain on weight-bearing area in the plantar surface of the heel, confirmed clinically by localized tenderness by palpation. The precipitating causes are repeated trauma due to prolonged walking, مشي مسافات طويلة, مشاية. أمو proper shoes, أمو proper الأحذية الضيقة أو العالية. And also Reiter's syndrome. Here we have two types of plantar fasciitis. Mechanical plantar fasciitis, which is the commonest one, or we might have an inflammatory seronegative spondyloarthropathies, like ankylosing spondylitis, like associated with ankylosing and Reiter's syndrome. And plantar fasciitis, the radiological finding might be negative, or we may have a calcaneal spear. In mechanical type, the calcaneal spear is sharp. While in inflammatory plantar fasciitis, the calcaneal spear is fluffy, whiskery, مشرشر. Here on the right we have the adhesive capsulitis. Adhesive capsulitis is the frozen shoulder. There is a restriction of the all range of movement, of the 6 movements. On the left one, we have a painful arc syndrome. amid arc pain in condition of supraspinatus syndrome. Okay, here we have supraspinatus calcification. The calcification is of the hydroxyapatite crystals, long standing. Yes. Here we have a tennis elbow. One of the methods of treatment of tennis elbow is by rest. You can put any type of rest on to the elbow region. A new topic is multiple regional pain syndromes. Here we have widespread pain localized to the soft tissue. Mostly it might be due to one of the following two conditions. One, hypermobility syndrome. Two, fibromyalgia. So we shall start with hypermobility syndrome. Hypermobility syndrome mostly are benign hypermobility syndrome. Sometimes hypermobility is faced with diseases associated with hypermobility as Marfan syndrome and Ehlers-Danlos syndrome. So we shall speak about the benign hypermobility syndrome. Benign hypermobility syndrome. Hypermobile persons are predisposed to ligamentous strain, traumatic enthesiopathy, mechanical back pain, arthralgia, and even dislocation mainly of the glenohumeral joint. Here we have 5 tests for clinical purposes. We have 5 tests. For clinical purposes, benign hypermobility syndrome is diagnosed when we have 4 out of 9 scores or more, plus arthralgia in 4 or more joints for longer than 3 months. It seems that 10% of adults having some sort of hypermobility. So 10% of adults having some sort of mild hypermobility. Such persons are liable to back pain, to knee pain, and to arthralgias. Okay. Another condition is fibromyalgia. Another topic is fibromyalgia. Fibromyalgia is a common cause of multiple regional pain and disability, commonly associated with medically unexplained symptoms and other systems. It is a very common condition. The prevalence is 2 to 4% and increasing with age to reach 7% in females over the age of 70. Female to male ratio is 10 to 1. It might be associated with psychosomatic problems, with irritable bowel syndrome and others. Etiology: no structural, inflammatory, metabolic, or endocrine abnormality has been identified. So all investigations shall be negative. It is associated with sleep abnormality, reduced threshold to pain perception, and tolerance. Clinically, multiple regional pain involving the four quadrants of the body. The four quadrants of the body are involved, often focusing on the neck and upper back. Usually it is of long duration at presentation. At presentation, just one or a few regions may dominate the picture. Later, all the four body quadrants will be affected. Both arms, both legs, neck and back. The pain is diffuse, associated with fatigue. There are no synovitis, no organic damage. There are hyperalgesia at 18 tender points. Patients may also have coexisting osteoarthritis or spondylosis, which may make the diagnosis more difficult. The patient often having sleep disturbances, irritable bowel syndrome, a variety of non-specific symptoms, difficulty in attention, paresthesia, migraine, tension headache. As just we have said, the investigations usually are negative, unless the patient having another coexisting condition as the osteoarthritis or spondylosis. Management of fibromyalgia aims to educate the patient about his condition, about her condition. Usually they are females. That the condition is benign, not difficult. Pain control, improvement of sleep, reassurance of the patient. Drugs. The first-line pharmacological therapy, the first-line drug pharmacological therapy for fibromyalgia is a tricyclic antidepressant, amitriptyline. Another lines of treatment are symptomatic, non-steroidal, and physical therapy. As you see, fibromyalgia is a very common condition. Tricyclic antidepressants are usually the first-line pharmacological treatment. Here we have, in this picture, there is a chronic widespread pain in all four quadrants of the body and the axial skeleton. And we have 11, at least you should have 11 out of 18 tender points. But in the early cases, there might be pain in one or few positions dominating the picture. Fibromyalgia is a common condition. There is a widespread pain involving all four quadrants of the body and the axial skeleton, plus the presence of at least 11 of 18 tender points on physical examination. And at the early cases, we may have just one or few points of tenderness. A variety of non-specific symptoms are often present. These include fatigue, paresthesia, irritable bowel, migraine, headache, and deficit of attention and memory. The first line pharmacological treatment is tricyclic antidepressant plus other symptomatic treatments.